Our report have two parts. First part, I present. Second part, and Dr. Ngoc. Dr. Ngoc, she is Minister of Health of Vietnam. Medical Service Administration. I present the Vietnam contact, and this is front of the pagoda, the lotus flower. Lotus flower is the national flower. Prevalence of 10 mental disorder in Vietnam. The study released in 2002. 10 mental disorder in Vietnam, 14.9% population. Highest alcohol abuse, and then depression, then anxiety, then behavioral disorder in adolescent, then dementia, then mental retardation, and schizophrenia, and so on. Abuse 0.3%. Drug abuse. Now it is maybe more. Now we are studying the 10 mental disorder. Maybe the end of this year finish, we have the data of data. This study is the product of the Hanoi School of Public Health. It is 2008. That is the number of years lost due to inhaled disability or early death in men disease category in 2008 in Vietnam. Mental and neurological disorder of 15%. I don't know exactly the mental disorder and rate of mental disorder and rate of mental neurological, because it is the product of Hanoi School. But this is the result the Ministry of Health done. In 15% the trauma, and neuro and mental disorder 18 trauma and disorder of mental and neurological, and 17 in cardiology. Three the top, the right on top of the disease. Infamous, the mental and neurological disorder, 22% over mental, over the male, 7%. Progress in the last 10 to 15 years, Vietnam aims to develop an integrated hospital and community mental health system, upgrading of psychiatric hospital and national and province level. 1998 and 1999, first national target program on community-based mental health care. Community-based program implemented in about 80% commune among total of 11,000 commune. Exactly 11,157 commune. Increased recognition of the essence of psychosocial support in mental health care. Ongoing challenge in Vietnam. Inadequate mental health policy and plan. No mental health law. Lack of mental health priority for public health concern and funding. Mental health services are provided more in hospital than in the community. Community mental health care limit to treatment of schizophrenia, epilepsy, and pilot skin and depression. Irrigate human resource, both quality and quality. Very few psychologists, social workers, occupation therapists. One of the biggest shortages of psychiatrists in NMIC. Inadequate capacity to provide non-pharmacological therapies, limited community-based rehabilitation and psychosocial support service. Mental health system in Vietnam. In Vietnam, there are two systems mental health care. First, under the Directory Minister of Health, responsible for mental health service, including promotion, prevention, treatment, rehabilitation. Second, under the Directory of Ministry of Labor, Invalid and Social Affairs, MOLISA. Responsible for rehabilitation and social service for people with mental disorder. Two system collaboration discussed in activity in community on mental health care in community. Đây là của em. Mental health system of health sector. Highest Minister of Health. First level, central level. We have three central level. Central Psychiatric Hospital. Number one in North Vietnam, in Hanoi. Central Psychiatric Hospital. Number two in South Vietnam, in Đồng Nai province. And National Institute of Mental Health under and the Bạch Mai Hospital. Bạch Mai is the general hospital, biggest general hospital in Vietnam. Provincial level in Vietnam, there are 63 province and city. Now, there are 33 psychiatric hospital, provincial hospital, and 17 psychiatric department in general hospital, provincial general hospital, and 24 psychiatric department in provincial social disease prevention and control center, and one psychiatric department in provincial preventive medicine center. This is named ago. Now most this name one province this name, and three mental health center. Now there are 3 province mental health center in 3 province. And this state level, now Vietnam there are 699 districts. In each district, there is district health center. And commune level, there is 11,127 commune. In each commune, there is commune health station. Here, the staff, the medical care, the patient come here to for take the medicine, for take some the while the counseling. I finished my report. Thank you.
I will share about the National Taskforce on Community Mental Health Care System Development in Vietnam from 2010 to 2014. This program is a collaborative project between the Ministry of Health and the CIMH, and with support funding from Atlantic Philanthropies. And the first, I would like to explain why we have this National Task Force on the mental health from the 2007 to 2008. WHO to support for the Vietnam to organize a 2 meeting, and in this meeting they explore the option for the further development of the Vietnam mental health care system. And the CIMH work as the international consultation for this workshop. I'm sorry. And at this workshop, we all the participants and international consultation experts to agree that it is a very essential and necessary to establish a national task force for the community mental health system development in Vietnam. So, based on the recommendation of the 2 workshops, the CIMH in collaborate with the Vietnam team to develop the proposal to submit to the Atlantic Philanthropy, and this project approved from 2010, And this is a project we will implement for 2 years. And that is the outcome of the 2 workshops. So this means that after 2 years from 2008, where the outcome of the workshop to become the results for Vietnam to set up the National Task Force for Vietnam. The goals of the Task Force project to support the Ministry of Health in collaboration with the key stakeholders, including other relevant ministries, to plan, design, and deliver effective, accessible, and affordable community mental health and social protection services to the population of Vietnam. And for this project, we have 3 components. The first is to establish the National Task Force on the mental health system development in Vietnam to strengthen mental health care system in Vietnam. And the second component is to provide policy and research support to develop high quality situation analysis and to provide evidence-based recommendation for the development of community mental health services and that are appropriate to the culture and socio-economic context in Vietnam. And the last component is training and human resource development, particularly leadership training to support policy and service development. And for the first component, we is to establish National Task Force. So in this component, we strengthen partnerships, and the host of Task Force Secretary in this National Task Force, we set up the Task Force Secretariat to support and to help the National Task Force to do activity of the Task Force plan. And strengthen interdisciplinary and inter-sectoral collaboration. We have some stakeholder and collaborate between among the government, academic, and international agency, NGO, and in NGO. For the government, we have some ministries related to mental health care in Vietnam. It's the Ministry of Health, Labor, Invalids, and Social Affairs, and Education and Training, and Central and Provincial Psychiatric Hospital. You can see in the picture is one group we set up to site visit in the Provincial Psychiatric Hospital and Provincial Health Department to discuss how to improve the mental health care program. And based on the idea from the provincial level, we define what is the priority, what is the main plan for to improve the mental health care system in Vietnam. So based on the recommendation, we put in the plan for the National Task Force program. And the second is the academy. We have Hanoi Medical University, Hanoi School of Public Health, and University of Labor, Invalids, and Social Affairs. And we have an international agency, WHO and UNICEF. In last week, we just have a small discussion with WHO in Hanoi office, and we present a summary about the National Task Force, and WHO think the leader of the WHO office in Hanoi, he thinks that is the National Task Force in Vietnam. We had to set up first, and because it's a basic framework to support, to improve for the mental health care in Vietnam. So they think they will support more for the funding to support for the National Task Force to work more and to define and support for some activity of the program. And because he thinks that the first we had to set up, and then based on the results of the National Task Force, we have to discuss is about the action plan in Vietnam and support for each activity. And we have some NGO and support on the mental health. And for this component, we have some of the main activities. The first is develop national comprehensive mental health strategy from 2013 to 2020. And in this period, we are prepared to draft the plan to develop a national strategy, because we know that the global mental health strategy develops things, so we will follow that and we adapt that for the Vietnam. And for this activity, we would like to have international support to prepare for this. Because now we have a national program, but we think that it's not comprehensive and not clear. It's not like a national program. It's not specific. And the second is support drafting on national mental health action plan and advocate for the mental health law, like Dr. Cuong present, because now we don't have a mental health law, so we had to advocate to develop for the mental health law and increase the public awareness of the population on the mental health burden and how to prevent and control, and develop integrated community mental health services model, and develop human resource development plan, and strengthen attention on women and children's mental health. For the women and children's mental health, we in our country we don't focus in educate. So we want to, for this project, will help us how to define the priority and make action plan for the mental health for the women and children. And protect the human rights of people with mental disorders. And the second component on the research, we will have we will implement the national mental health system survey, and now we are collaborate with the CIMH to develop the proposal for the survey, and we will focus some areas. The first, evaluation of policy and legislation documents, and the survey will be implemented in the whole country. Now we will collect the information about the structure, facility, human resource, and the medication for the mental health and something. And we will organize field visits to the 8 provinces, representative for the 8 regions in Vietnam. So far, I think this is the biggest and the comprehensive survey in Vietnam, because it's a past we do the survey in the small and separate some area. In this survey we do is like a comprehensive survey, and with the support from the CIMH and from the expert are the researcher. And so I think we hope that we will have the values result of data for the Vietnam. Yeah. And for the monitoring and evaluation system, we will draft a framework for the M&E, and we will pilot this system. And I think M&E system will support for us to improve the mental health care system in Vietnam, because from 2008 to from 1998, we implement the national program. But so far, we has not yet to set up the M&E system. So how to evaluate our program is effective? We don't have evidence base, so we want to develop that M&E for this program in my country. And for this component, we will trap on the ongoing collaborative research on the mental health care. Maybe some international experts and the national expert in Vietnam will collaborate with develop to the new research project on the mental health. And the third component, we focus on leadership training. And so far we have 47 alumni from Vietnam to attend the International Mental Health Leadership Program organized by CIMH Melbourne University. And last year we are lucky because CIMH organized the training for only Vietnam participants. We have a big group to join that training, and I think it's very good for Vietnam. And for this year, we have 13 more people to join that training. This program will organize on October. Yes, and based on the training in Melbourne University, the CIMH will bring and transfer this training to Vietnam, and the Mental Health Institute in Vietnam will adapt this training for the Vietnam. We will design the programs, curriculum, and program for Vietnam with support and consultation from the CIMH. And some participants from the training in Melbourne will be the teacher for the program in Vietnam. And so we intend to launch the first training in Vietnam in November of 2013. And that is my presentation. Thank you very much.